Mounjaro or Zepbound nausea often peaks after your first dose or a dose increase. Smaller, lower-fat meals help you more than skipping food all day. Stop eating at the first sign of fullness and sip fluids between meals. Most nausea improves as your body adapts. Repeated vomiting, severe abdominal pain, or an inability to keep fluids down is not a normal adjustment. Mounjaro and Zepbound, both made with Tirzepatide, slow how quickly food leaves the stomach. Your meal therefore stays inside longer than it did before treatment. Your usual portions can suddenly create pressure, burping, early fullness, and nausea. These effects often feel strongest after starting or raising the dose, then weaken with time. One misunderstanding may cause you unnecessary worry. Your nausea usually does not mean the injection mixed badly with breakfast. It more often reflects slower stomach emptying, a recent dose increase, or a meal that exceeded your new limit. Trials show how often it occurs. About 1/4 of people using Zepbound reported nausea. That means it was common, but most participants did not report it. Rates were lower in Mounjaro diabetes trials, but different patients and study designs prevent a direct comparison. When your nausea is mild and fluids stay down, choose foods that are easier on your stomach. Toast, crackers, plain rice, oatmeal, bananas, applesauce, broth, and simple soup are practical choices. Cold or room temperature food may also help when cooking smells trigger nausea. Use these foods briefly, then rebuild a balanced diet as your symptoms settle. Portion size often matters more than finding one perfect food. Divide 3 usual meals into 4 or 5 smaller meals. Stop when fullness first appears, not when your plate is empty. A few extra bites can stay in your stomach for hours and turn mild pressure into nausea. Once bland food stays down, add modest portions of protein. Eggs, plain yogurt, cottage cheese, tofu, fish, or tender chicken can help you maintain muscle. Avoid forcing a large serving because protein-rich food can still feel heavy. Your goal is steady intake, not a perfect meal. You may tolerate fluids better when you take frequent small sips. A large drink beside a full meal can stretch your stomach and worsen pressure. Water, broth, or an electrolyte drink can replace lost fluid. Sip between meals when possible, especially after vomiting or diarrhea. Carbonated drinks can add gas to your already full stomach. A large caffeinated coffee may also worsen reflux or shakiness when you have eaten very little. Choose drinks without bubbles first, then return to usual drinks once you are eating normally. Fatty food is one of the most reliable triggers. Fried chicken, pizza, creamy sauces, sausage, and butter-heavy dishes remain in your stomach longer. Alcohol may irritate your stomach and worsen dehydration. A rich dinner may feel manageable while you eat, then produce nausea several hours later. Spicy food, sweet desserts, and oversized raw salads can also cause trouble. A salad may be nutritious but still fill your stomach too much. Add cheese, nuts, avocado, and oily dressing, and it becomes bulky and high in fat. Healthy ingredients can still make nausea worse. Avoiding trigger foods does not mean you should avoid food altogether. Skipping food all day may reduce pressure briefly, but it can cause weakness, dizziness, constipation, and poor protein intake. You may then become so hungry that a large evening meal is too much for your slowly emptying stomach. That cycle often restarts the nausea. Slower eating may help prevent the next wave. Take smaller bites, chew fully, and pause before adding more food. Stay upright after eating when burping or reflux appears. Lying flat can let stomach contents move upward and create burning or sour fluid in your throat. A gentle walk after a meal may reduce that heavy, stuck feeling. Stop if walking worsens dizziness. Rest and hydration matter more when you have eaten very little. You also do not need to fast before the injection. You can inject either Mounjaro or Zepbound with or without food. You may choose a lighter meal near injection day when your symptoms follow a predictable pattern. That is a comfort strategy, not a rule that prevents nausea. There is no fixed day when your nausea should stop. In trials, most nausea, vomiting, and diarrhea appeared during dose increases and became less frequent over time. Your symptoms may therefore settle after several weeks, then return briefly after another increase. What matters most is whether your symptoms are improving or worsening. That pattern connects directly to your dosing schedule. Dose increases are normally spaced by at least 4 weeks. That spacing gives your body time to adjust before a higher dose causes stronger stomach effects. Faster dose increases are not helpful when your current dose already disrupts eating. Do not increase simply because the next date has arrived. Severe nausea does not mean the treatment is working better. Vomiting is not useful progress. A tolerable dose that supports your nutrition and normal daily function is usually more sustainable. Daily function matters more than speed. If symptoms continue at a stable dose, look beyond the injection. Constipation can keep your nausea going because your stomach and intestines are moving slowly. Reflux, iron tablets, the diabetes medicine metformin, antibiotics, and some pain medicines may also contribute. The injection may be only one reason for your nausea. Prescription nausea medicine may help, but your ongoing symptoms may still have another cause. Some options worsen constipation or sleepiness. The right treatment depends on vomiting, reflux, constipation, or diarrhea, and whether another medicine contributes. Repeatedly relying on nausea medicine is not a substitute for reviewing whether your dose is too high. If your nausea keeps returning, sort it into 3 practical levels. Mild nausea still lets you drink fluids, eat small meals, urinate normally, and go about your day. Moderate nausea repeatedly interrupts your eating, sleep, or work. Severe nausea prevents you from keeping fluids down or going about your day. Very little urine, faintness, or confusion are warning signs that need prompt medical attention. Beyond that general severity scale, a few specific signs point to an urgent problem. Severe upper abdominal pain that spreads to your back may signal an inflamed pancreas. Right-sided pain with fever or yellow skin may point to a gallbladder problem. Sweating or shaking during poor intake may indicate low blood sugar, especially if you use insulin or certain diabetes pills. Seek prompt medical care for these signs. Outside those urgent signs, weekly timing makes your symptoms easier to interpret. Note whether nausea starts after your injection and fades before your next dose. Random new nausea at a stable dose raises other possibilities, including infection, constipation, or another medicine. A stomach virus or food poisoning often appears outside your usual injection pattern. Track your injection date, dose, meal size, vomiting, bowel changes, and ability to drink for several days. Also note whether your symptoms are improving or worsening. Notes may reveal triggers and help your clinician review the dose. Contact your clinician when nausea repeatedly prevents normal eating, drinking, sleep, or work. Seek urgent care for warning signs or vomiting that keeps you from drinking. You can ease mild nausea with smaller meals, lower fat food, small protein portions, and steady sips. Improvement over time is reassuring, especially when you can drink and urinate normally. Worsening symptoms, inability to drink, or severe pain mean you need medical care, not more waiting. Focus on drinking, daily activities, pain, and whether you are improving. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.